interact with us on the Jipange campaign. So moving forward, I'll give a brief overview of African Pharmaceutical Network and who we are as an organization. So African Pharmaceutical Network was established in 2020 in the backdrop of COVID-19, and the purpose of this particular organization was to bring together professionals, stakeholders, and organizations working within the pharmaceutical industry for the purpose of knowledge sharing, policy shaping, and innovation nurturing partnerships, all leading towards access to reliable, safe, and quality medicines in Africa. But we are also including a few products this particular afternoon that when we are bringing these products to market, that they are safe, they are effective, and they are quality. So even for our communities, we want to ensure that they are receiving the best products possible and they are very much safe for them to use. Now I'll move on to a quick pre-survey for us when it comes to what we are doing this particular afternoon for the information session. So I want to welcome you to quickly scan the QR code that is before your screen. And we have just a few questions that we want to answer before we get into the discussions of the day. So you can scan the QR code. Alternatively, you can click on the link that is on the chat so that you can also access this particular form. All right, so get to let us know first. How are you feeling today? It's a Friday. How are you feeling? The link has been posted on the chat. Get to let us know how you're feeling today. Okay, get to let us know how you're feeling today. If you're having challenges with scanning the QR code, the link has been posted on the chat. You can click on it and you'll have access and be able to interact with us on this particular pre-survey. Thank you. I have one response already. Feeling happy. It's a Friday. Thank you. How are you feeling today? Thank you. I'm seeing 2 responses. You're feeling awesome. Thank you. Keep your responses coming in. All right. How are you feeling today? I'm really looking forward to the weekend. Oh, we are together with you. Thank you so much. All right. Keep your responses coming in. I'll be able to read them. So the second question says, what is planning, in your own words, methods to control births, pregnancy prevention, planning for when and how many children you need to have? Very true. Thank you. Keep your responses coming in. What family planning methods do you know of? IUDs, pills, T2, they must be true. Oral pills, injectables, IUDs, thank you. Have you heard of any injectable family planning method? And those who have responded on the survey, 80%, actually 83% now, have actually said yes. The responses are increasing. Thank you. Thank you. Thank you. All right. What are your expectations for this webinar? Learning more. I expect to gain a better understanding of injectable family planning methods, including how they work, their effectiveness, benefits, possible side effects, and how to counsel clients so that they can make informed decisions. Wonderful, wonderful. Thank you. To learn more, especially for on the criteria of selection, thank you so much. You're definitely going to receive a lot of information on that. We have Dr. Wendy on the call, and she'll be guiding us through that. Okay, to update myself and learn more, thank you. Learning, answering questions, and having good conversations. Oh, thank you. So nice. More knowledge on family planning. Thank you. Want to receive more knowledge on family planning, raising awareness on the subject, to learn more about FP. Thank you so much. The survey itself is still running on the background. If you are just clicking on the link and you're still sharing your responses, please go ahead and share. We'll be able to get that information and even be able to share when we are continuing with the program itself. Okay, thank you. Thank you, Polycarp. So we'll move on to the next slide. Why this particular session on understanding family planning options for the general public? So for this particular session, we curated it with the aim of appraising the public, just to help them know the options that are available for them, how they can use them, and also to improve their knowledge on family planning methods and be able to plan their lives correctly. When I think of family planning options as a young individual, even outside the space of healthcare and pharmaceuticals, just as a general person, I ask myself, which options do I know of? And when we are seated with people, we hear so many things. Kuna hii, nasikia kuna P2, kuna hii ukitumia injectable hapa therefore maybe kuna hizi side effects, and I'm like, okay, basi sitatumia hiyo. What can I use? And most of the times, the information that I'm going to get out there will definitely not be accurate. So because of misinformation, malinformation, these particular forms of misinformations that are coming up in this particular age where information is always accessible online, there is need to bring the accurate information to the public. So we created this particular session to be able to inform individuals of the public the accurate information about these particular methods that are there, their safety profile, their quality profile as well, and even their effectiveness. Because unaweza pata mtu anasema, mimi nilikuwa natumia hii injectable, after maybe some time, nikashika ball. Sasa hapo kuna question ya effectiveness. The next time ukiniambia niitumie, niko like, no, I cannot use it because it bounce the other time. So is it effective? All right. So is it effective for me? Is it effective for someone else who I'm going to encourage them to use it? How will they use it? That particular kind of information. And also to help them to plan their future. If you are in a space where you are planning your life goals, you want to study, but you're in a relationship. You want to travel, but here you are with a partner. how then do I get to plan my life and still have a good life or a good sexual life with my partner? That is where the options of family planning will definitely come into play. So moving on to the next slide, why Jipende Jipange? To create awareness. This program aims to increase awareness on family planning options, improving sexual reproductive health for men and women, and also improving their quality of life as well. And also to improve accessibility of family planning methods. When we look at the options or the service points that are available for us to receive family planning methods, where do we go to get this, the methods or the services? Is it a hospital? Is it a clinic? Is it a pharmacy? And how many are they? There are individuals who would prefer to go to a hospital, the individuals who would prefer to go to a clinic. But do they know that they can come to a pharmacy? No, because pharmacists are equally licensed and trained to offer family planning options here in Kenya. So we want to make sure that the general public is equally aware that you are able to access these family planning options even at the pharmacy, at the hospital, and at the clinic. We also want to raise awareness on more FP access points beyond the hospital and the clinics, and this includes the pharmacies. And I know in this particular call, we are joined by a couple of pharmacists here with us. We definitely would love to hear how your interactions have been, how your experiences have been when it comes to the uptake of family planning methods in your specific pharmacy where you are practicing. All right, so I'll move on to the next slide and then be able to pause and just pose some questions for us. Okay, before I get into this particular session where Dr. Wendy will be taking us through the available options, I would love to hear from you on what your experiences have been with different family planning options, whether you've heard about them, whether you've used them, whatever it is that you can share with us as an insight this particular afternoon. Get to let us know. Okay. I'm not seeing any questions on the chat at the moment, but feel free to interact with us on this. What are some of the experiences that you've had about or you've experienced as a professional, as a member of the general public when it comes to the available family planning methods in our setting? And let me just select, let me see. I want to choose Anna Grace. How are you? Thank you, Anna. This is more of a conversation. I don't want anyone to feel like we are in a lecture. We're not in a lecture. We are just conversing. What are some of the experiences that we've had when it comes to family planning methods? Whether you're a member of the general public, whether you're a healthcare provider, how has it been for you? Okay. You can equally type and text on the chat. We'll be able to receive your message. Let me try.
Hello.
Yes, go ahead.
So I'm Muguluso Nedrin. I'm a medical clinic officer from Uganda. So my experience with the family planning methods when it comes to patients, basically I've had an experience where patients share their worry with the side effects that come along with particular family planning methods they use. And this arises concern, a little bit of concern as a healthcare worker. I have to decide or give appropriate advice. So basically, my experience has been with patients complaining about side effects that come along.
Very true. Thank you so much for sharing that insight with us, the issue of side effects. And, you know, for anyone who would consume a medicine or a medical product, they would definitely love to know the side effects. When I use this, what's going to happen to me? How will my body react to this? Thank you so much for sharing that with us. And this is from Uganda. And I see Michael saying side effects concerns, especially when it comes to weight gain and libido changes because of the family planning methods. All right. Well, thank you so much for sharing that with us. So these are some of the things that are coming up. Any other, please feel free to unmute your mic. Feel free to text on the chat. We want to hear from you. Thank you, Petrus. I want to say Kwasa, biomedical engineer. I'm yet to know if these are true about how family planning methods have been talked about is concerning, and it talks about possibility of infertility as a long-term side effect. And you'd love to get some clarification on that. Thank you for sharing that. We'll keep that as a question, and Dr. Wendy will be able to answer you even when we get into this particular section of the conversation. Thank you so much. We've definitely heard of this, and there are many other concerns. Yes, go ahead. Go ahead.
I would like to share one.
Mm-hmm.
So specifically with regards to hormonal methods, there's a lot of sayings that there are less side effects that come with using emergency contraceptives compared to the long-term ones. So perhaps by the end of this call, we'll be able to know if that is true or if it's just, like a myth, because some people are usually, scared to go for the long-term hormonal contraceptive methods and just prefer to use the emergency one or the other non-hormonal methods like, calendar outdraw, etc. So hoping to get an answer on that. Is it true or is it a myth? Yeah, thank you.
Thank you so much, Chris. And we have Dr. Wendy on the call. She'll be able to clarify on that as well. Any other, what else have we had? What have our experiences been? I've heard from Chris. I have heard from Kwasa. Feel free to chip in and share. You can share as a member of the general public, and you can share as a professional as well, and what you have encountered. What are your patients saying? All right, I'm not seeing any feedback on the chat, but feel free to share with us. All right. Thank you, Lucy. I see your text. It says assurances on effectiveness of the methods when used, especially with the youths. Very true. And I feel like majority of us can attest. Sometimes you're introduced to these products because you've heard about them through your friends, and they don't have the accurate information, and then they choose to use that particular product, and they use it wrongly, and then it bounces. So we want to also see when it comes to effectiveness, does it really work, and how do you use them so that they are also effective? Because if you don't use it correctly, it's definitely won't be effective. And Vera is saying this is from specified the men, all right, from the general public, their opinion. For vasectomy, the man needs to inform his wife for it to work. Wow. Dr. Wendy will tell us if it is a myth or not. Do you have to let them know so that it works? If you don't say and you do it, it will bounce. So we want to know, according to science, is that true or false? Thank you so much, Vera. I appreciate that particular insight and contribution that you've shared in us. Anyone else who wants to speak? I'm getting background noise, so if you're sharing, please raise your voice. All right, thank you so much, and keep the insights coming in. Thank you. So I want to hand it over to Dr. Wendy Orenga. I was just introducing this particular session, and she will take us through the family planning methods that are available in the setting. And some of the questions that have been shared will equally be answered, and I appreciate that Dr. David is also on the call with us. He'll be able to chip in even as we continue the discussions, but keep the session lively and enjoy the session. Thank you. Wendy, over to you.
Thank you, Juliet, for that wonderful introduction of the session today. I hope we are all well and you can hear me. So I've seen very, very interesting takes and questions on the chat, and I'll be able to answer that as we continue with the session. So moving swiftly, we're gonna get into the various methods of family planning available in our setting in Kenya, as well as other countries in LMICs in Africa. So, but specifically, this is situated in Kenya. So for the various methods, and I would like this to be more of a discussion, not a lecture. So we have hormonal methods, non-hormonal methods, we have barrier methods, we have fertility awareness-based methods, and permanent methods. And I would like to ask us about the different hormonal methods we've come across, maybe the ones we've been able to sell in our pharmacies for the community pharmacists who are here, or the hospital pharmacists, and also for the general public, maybe the ones we've come across. Let me open it to the audience. You can type on the chat. You can also unmute and tell us what are the different hormonal methods you know. Feel free to contribute to this conversation. What forms of hormonal methods do we know?
Hi, Wendy.
Hi.
What forms? We have
Yes.
injectables, we have oral pills. So for example, the injectables, we have these progesterone depot injections. And then for oral, we have the combined oral where we have the estrogen and progesterone, and also we have the progesterone only pills, and also the emergency pills. Thank you.
Thank you, Vera, for that. She has mentioned the oral pills, the combined, and as well as the progestin only. We have the injectables, we have the emergency contraceptives. Yes, these are some of the hormonal methods we have. We also have other methods like hormonal containing intrauterine devices. We have contraceptive patches. We have vaginal rings. I don't know if we've come across this in our setting, but I know mostly people have interacted with the pills and injectables. We also have non-hormonal methods. Any non-hormonal methods we've come across? Anyone?
I know of one, the copper intrauterine device.
Yes. We have the copper intrauterine device. Thank you, Vera, for that. What about barrier methods?
There are some comments in the chat.
Oh, thank you for that, David. was not seeing this. We have Mugulusi saying use of condoms. Polycarp said female and male condoms. Yes, these are some of the barrier methods we have. And we also have cervical caps and diaphragms, but in our setting, the condoms are the most common. We also have fertility awareness-based methods. Do we have any idea of how this work, or if we've heard about this? We can also say something about this. I don't know if you've heard about the calendar method, the tracking of the cervical mucus. Yeah, these are some of the fertility awareness-based methods people use. We also have Mugulusi says use of beads. Yes, people use this to track the menstrual cycle, so they are able to know the days where they are fertile, to know the safe days as well. We also know of people using apps like the Flow app to be able to know their fertility days as well, and so many others. And about permanent methods, we saw someone talk about vasectomy and had a very interesting take on it, which we will talk about. So that is one of the methods of permanent family planning methods. We also have tubal ligation. So these are some of the various family planning methods in our setting. And do we know where these methods can be accessed in our setting? Where are the different places people can go to buy, purchase, or even get these methods that we've talked about? Please, again, feel free to contribute to this because it's more of a discussion, yeah? Ngulusi says pharmacy is one place, drug shops as well. Any other access points for this family planning products? Samba says, I know of Marie Stops. Yes. For those of us who might not be familiar with Marie Stops, it's a reproductive and fertility clinic. And it has a chain, it's more of chains in Kenya. I'm not seeing anyone talking of hospitals. Yes, Anna Grace says health centers, hospitals as well. Very well. So these products can be found in public and private hospitals. Someone mentioned of Marie Stops, yes, fertility clinics, and we have community pharmacies. And for community pharmacies, it's very, I would want to know, do we have like specific family planning products that are found there, or what's your take on which family planning products should be sold in community pharmacies? Yeah, so I'll repeat that. So for community pharmacies, do we have specific family planning products that can be sold there, or can all these family planning products and services be purchased in community pharmacies? So I'll pose that question. We can write our thoughts on it on the chat. So We can go to the previous slide first as I answer some of the questions that had been posed. So Mugulusi had said what he looks to learn from this session today, assurances of the effectiveness of the various methods used, especially with the youth. So for today, we're just looking at the overview of the family planning methods. But as we go on with the sessions, we'll be able to get deeper into this method to discuss the science behind it, the effectiveness, the challenges that might come from using this family planning product. I'm talking about adverse effects when I say this and how this can be overcome. Another question that was posed by Vera was, for vasectomy, does the man need to inform his wife or partner for it to work? I'd say whether you inform your partner or not, as long as the vasectomy has been done, and we usually say it is 99% effective, and it takes, for the first 3 months, the man is supposed to use a backup method because they're not fully healed. So it might not be as effective and there's risk for pregnancy. But as time goes by, they heal well. It should be able to offer protection against pregnancy. But whether they inform their partner or not, it should work. It's just a bit of unethical to undergo such a procedure and not tell your partner. So, and that's a personal take. I would like to hear what the other people have to say in the group about this specific take on vasectomy. What are our thoughts on this?
Well, I think conventionally, I don't think there's been substantial level of adoption and acceptance of vasectomy as a contraceptive method. It's gaining prominence, that's for sure. In terms of being able to disclose and willingness to disclose, I think when we started talking about contraceptives, I would say when I started engaging in this conversation with over 15 years, almost 20 years ago, the narrative was more on, yes, when you're talking about contraceptives, it denotes that you are engaging in sexual activity. And in our African context, engaging in sexual activity is a taboo topic that people don't like talking about. For men, the essence and the measure of a man's success from an African narrative, the socio-cultural side of it, is having children and having people to take after you. Going for vasectomy is eliminating that possibility. How many men are willing to confess and acknowledge that they do not intend to have children, and therefore then they are going for vasectomy? I would be glad to hear from people in this conversation today to see whether people would be open to that. And I look at it in the sense that even for some of the conversation we have in our societies, when somebody is married and they're not able to get a child, by default we blame the woman. And the assumption will be the woman cannot give birth and it is her problem. But probably some of the times it is infertility of the man, but they're not willing to acknowledge. So how do we take up such conversation? I would be glad to hear from what people have here to say as well. It is good to declare, but I don't think people are willing to declare or even consider that pathway as easy as possible.
Thank you, David, for that. That's a very interesting conversation brought on, especially on the tabooness of speaking about such topics, people willing to say they want to undergo these procedures or if they have undergone them, and how they are viewed, the perception they get from society. So that's a very interesting one. And as Dr. David has asked us, please let's contribute to this conversation. Yeah.
I'd be glad to hear from some of the men in the room. Would they
Yes.
be open to consider vasectomy? And if so, would they discuss it with their family, with their partners?
Yes, the men in the group, kindly give us your text on this.
I think I'll go first. Me
Yes.
personally, I wouldn't consider that. I'd opt for other options, basically.
And what would inform this? Is it the permanence of the permanence nature of this, or is it the perception of society?
Both the perception of the society, but also for the mere fact that I can't have kids anymore, I wouldn't be able to take that. No.
Okay, so for you, is the fact that you want to have children. So if somebody came to you, Owen, and asked you, told you as a fellow brother or a man in your circle told you that they wanted to go for vasectomy, what would be your take on it? Would you allow them to? Would you discourage them, or what would be your take? I'm David coming to you today and telling you I want to go for vasectomy.
Of course, I would tell this person, I will brief you about other options and tell you the overview of the consequences of each of the methods. Then you take up your decision as an individual. That's up to you. I mean, mine is all about telling you all the options, and yours is to decide individually.
Okay. Thank you so much for that. I see there's a comment from Michael. Vasectomy, no, I may want some more kids later. That is good. That is good to understand. Is that aspect of optionality? Maybe you will change your mind over time. And generally, we all change our minds over time in different things. So yeah, that's true. And I would be glad to hear from the ladies in the room. What would be your take about your man or the man in your circle telling you that they want to consider vasectomy? Everybody has disappeared and left me here alone.
So me, I think of such a man as a man who cares. Like you're not leaving the burden of contraception to the woman. So yeah, I'd be glad and I'd be happy if many African men would embrace vasectomy.
But at what point? At what point would you say it's acceptable? They would go for it. And I'm looking at this. Maybe somebody decides they never want to have kids early in their lives, or probably later on when they've had a number of kids and they now want to stop having more kids, and that's it. So at what point would you recommend that?
After having kids. After having kids, and then you decide, okay, enough.
And
is
enough is enough.
Yes.
Okay. That's good to know. That's good to know. I'd be glad to hear from other people as well. Devayani, Anna Grace.
I think I am also with Vera on this one. If I ever had that someone in my circle wants to do that, I would honestly applaud them, like, because most of these methods, it lies on the woman and hardly ever on the man. But then I would ask them where this is coming from. Are you sure you don't want kids, or have you had enough? And then now you're like, yeah, okay, now I am done. But for those who haven't had any, are you convinced fully that I don't want a kid or kids? But if you've had enough and you and your partner have talked about it and you have agreed that we don't want any more, I think I would applaud them. Yeah.
Okay. Thank you so much for that. Over to you, Wendy.
Thank you, David. And thank you for the insights you've given as well. That is to the members who've contributed. And I see other questions, and let me just answer them and then we can continue. So Pepris has asked, from the list of the methods, I've not seen any natural method. I mean, traditionally, our parents were able to plan for childbearing, yet these methods were not that still.
There is a question that was asked in the group in terms of the channels for access of family planning methods. And maybe I think that this is a moment to ask a question for those of us who are in the room. In terms of access point, there's been a move towards ensuring we have several channels of access. One of them is community pharmacies. And there's a comment that Vera shared here earlier.
Yes, thank you for that. I'm seeing Vera had said not all family planning products can be sold in community pharmacies. Yeah, so before we get to the ones not sold in community pharmacies, which methods do we know can be accessed in community pharmacies? And Lucy had said emergency pills, combined oral contraceptives. I believe that is pills. Yeah. So, and Dr. David had contributed to this as well. In Kenya, there are guideline changes that permit pharmacies to offer contraceptive services and options. However, it is limited to those who are trained to offer injectable options. So, for this conversation today, I would like to enlighten us on what community pharmacies can offer besides the oral pills that we know, condoms, patches. In Kenya, it is permitted to offer injectable options. And this range from, as we had said, we have progestin-only injectables. We also have combined injectables. And aside from offering these products, we can also offer the injection service, but you have to be trained as a healthcare provider how to inject patients. And aside from that, there are injectables that are self-administered. For example, the DMPASC, depomedoxy progesterone acetate subcutaneous. I don't know how many of us have come across this particular product. If you've heard about DMPASC, you can give me a thumbs up. I see some of us have heard about it. Yes, so the DMPASC is a self-injectable kind of injection, and patients are able to inject themselves, or they can, if they choose to have it injected in the pharmacy or in the hospital, it can be done as well. But the most important thing is for the provider to be able to illustrate to the patients how to do this at the comfort of their home. That is the technique and the various things that have to be done, like sterilizing the injection sites and how to dispose the injection well after using it. So yes, these are some of the methods that can, and rather products that can be found in a community pharmacy. I can also pose the same question to us again, if there are any other methods aside from the ones that I've said that can be found in community pharmacies. If there are any, you can type on the chat. Dr. David has also posed a good question. For those of us in the room who are healthcare providers working in community pharmacies, are we open to get injectable contraceptives? And after that, what would make you go for this or recommend them to someone in your circles? Please, let's contribute to this. as I answer Pepris on the natural family planning methods. So I didn't mention it, but it falls under the fertility awareness-based methods, because the natural methods are worked by basically tracking the natural or the normal menstrual cycle. So counting the number of days, trying to understand the fertility window and abstaining during that time. Yeah. I hope I've answered you, Pepris.
And then there's the exclusive breastfeeding as well.
Yes. So, very well. Mugulusi says they will choose a pharmacy because it is convenient, accessible, and often saves time. I would recommend it. If the pharmacy staff is trained, they provide proper counseling, they ensure privacy, and offer safe, quality assured injectable contraceptives. Thank you for that insight, Mugulusi. Let us get more on this as well. I'm seeing another question from Anna Grace. There was a question on whether emergency pills have lesser side effects compared to longer term methods, and whether this affects the choice of methods opted by the majority. So about emergency pills, when we look at them, it's more on the usage, the number of times a person uses them. Because when you look at emergency pills, they have very high levels of hormones. If it's progesterone, you compare it with a daily oral pill, the level of progesterone in it is high. So if someone keeps using them several amounts of times in a year, you can imagine all the side effects that come with progesterone. For example, we have the bleeding changes, we have the heavy cramping, and it poses it leaves the user susceptible to hormonal effects and hormonal imbalances. So instead of someone using emergency pills as often, it is better to cancel them to get a more permanent or a better contraceptive to use, maybe an oral daily pill. We have injectables that they can use after every 3 months. We have IUDs. Basically, it is better in that sense. And then should this affect the choice of methods opted for by the majority? Definitely. By virtue that they can be exposed to hormonal imbalances, it is better to advise them to go for methods that have lesser, or rather the level of hormones in them are more balanced and they are safe in that sense. If you don't have any other question, I can continue, and any more questions that come, I will answer afterwards. So as I'd said, as we continue with the sessions, we'll get deeper into understanding community pharmacies as access points for family planning services, and also exploring these family planning methods deeper and trying to see what options are available, and for these options, what are some of the challenges that are associated with their use and how to overcome them. And for this, I would like your engagement for the upcoming sessions. When would you like us to have this? Would you like the session to be held at the same time like today, or would you like it to be at a different time? Maybe after work hours? Or if you're okay with the set time, you can also say that. I believe silence means
This is good for her. And Grace has confirmed it's good for her. And maybe I would come in. The other people are also saying Redemptor is also okay. So in the interim, I just wanted to share that this is part of a program that we're running, and we're trying to understand what are the enablers and also what are the challenges. And on the other end, how can we support people to have access to contraceptive services, especially some of the long-term methods, but also any other method that would be available through pharmacies, looking at it from a pharmacy side, but also looking at it from an access stand sometimes. So we see how that can have to happen from all of us. So for those of you who are able to, if you are a content creator, you create content, you drive health communication, you're a professional in practice, help us disseminate this information to as many people as possible. We have different social media links and social media channels will be shared here as well. Help us retweet, help us share it so that we reach as many people. And once we are doing that, one, we're bringing the message to people who need it, but also we are positioning different channels of care so that people can get the services and solutions that they need in their healthcare journey. So that is what we are hoping to accomplish. And we are hoping that in the subsequent one, you'll also help us bring in as many people in your networks to attend the next session when scheduled and shared with you. So that's it. Over to you, Wendy.
Thank you, David, for that. So for now, as we had said, this program, and as David has added as well, is to increase the awareness on the various family planning methods we have, and to also increase awareness on community pharmacies as access points for the various family planning methods. So kindly, as we continue with the sessions, I would ask us to keep on joining and be sharing as much about this program because it can benefit a lot of people. And you can also follow our pages, Dijipende Jipange, as we've shared on our chat box. You can also follow our channels on African Pharmaceutical Network, which we'll be sharing shortly, to be able to interact with the various things we post about this program, as well as family planning generally, for us to be able to learn. So as agreed, we'll be meeting again next week, Friday, because most people are okay with this timing, from 4 to 5 p.m. That will be well. And for now, I'd like us to do a little exercise. You can scan the QR code on your screen to do a small post survey. Kindly, you can scan, and I'll share the link as well on the chat box. Thank you, Juliet. Juliet has shared. If you're not able to scan the code, you can click the link and be able to participate on the post survey. Are we having any challenges accessing this post survey? If you're having any challenges, you can also tell us. And for the pharmacists and pharmaceutical technologies in the session today, this session is CPD accredited. you can subscribe at the PPB portal for you to get your points as early as now. Keep them responses coming, kindly. We have one response so far. We have 3 coming in. Let's continue responding. We have 4 responses. We can try and see the next question as the responses keep coming in. So the first question was, what family planning method would you recommend to a loved one? We have injectables because they are easy to discontinue, self-injection, either a barrier method or fertility awareness. Someone also said, I will discuss with the loved one on all the methods and their side effects and allow them to make the decision. This is very important. We talked about making informed choices. We have combined oral contraceptive pills, condoms use, and progesterone pills. Based on your experience in this session, what should we continue doing in the next sessions? Very lively and engaging session. Thank you. This was awesome. Maybe make it longer next time. Thank you for this. We'll take this into consideration. In depth, look on the side effects. Very well. Demystify the myths. So for this, as we go deeper into the family planning methods, how they work, we will definitely be addressing the side effects and demystifying more myths that are out there on contraceptives. And someone has said, absolutely. Thank you for that. Based on how we've run this session today, what should we stop doing in the next sessions? Keep up the good work. Thank you for that. Someone has said, questions in between the presentation. A full presentation can be done thereafter. Questions. Thank you for that insight. We shall be taking that into consideration. Nan and Neil, thank you for that. Any other comments? Thank you. I loved it. Generally, that was a good conversation. I believe it's going to be even better as we move forward. Great initiative, maybe sharing of slides as we share. Thank you for that. We shall be sharing the slides immediately after the session, but moving forward, maybe we can send during the presentation so that you can be able to move along with us. Thank you for taking part in this survey. And thank you for contributing and making it a lively session. We welcome you to more sessions that we'll be holding moving forward. Feel free to share the links as we share them. The more the merrier and the more we will learn. Again, have a great evening and thank you for joining us today. Thank you.
Thank you too. Bye.
Bye. Thank you, Vera.
Bye.